Driving vehicles. Shantaram, a 25-year-old rickshaw driver, consults a doctor for recurrent pain in both his wrists, but more discomfort in the right wrist. After a quick examination and advising X-rays and other tests, prescribes anti-inflammatory drugs. If the doctor had asked him, "What exactly is the nature of your work?" he would have understood the cause of his work-related wrist pain. Effective history-taking has long been identified as a core discipline in treating patients. Spending more time compiling a good patient history has been known to provide the most benefit as compared to long physical examinations and expensive laboratory tests. Collecting an incomplete history can affect initial therapy and all subsequent decisions for treatment. Therefore, it is essential that primary care physicians ensure that neither the patient nor the health system is unduly burdened by deficient history-taking. Primary care providers and family physicians can play an important role in improving the recognition of occupational disease, preventing progressive illness and disability in their own patients, and contributing to the protection of other workers similarly exposed. This role can be maximized if physicians raise their level of suspicion for workplace disease, develop skills in taking occupational histories, and also learn basics of advising prevention. Industry profile. As per the National Highways Authority of India, about 65% of freight and 80% passenger traffic is carried by the roads. The national highways carry about 40% of total road traffic, though only about 2% of the road network is covered by these roads. Drivers play an important role in facilitating movement of people, goods, and information on the road network. Public transport remains the primary mode of transport for most of the livelihood in India, and India's public transport systems are among the most heavily used in the world. Motor vehicle population in India is low by international standards, with only 24.85 million cars on roads. The number of two-wheelers like motorcycle and scooter is considerably higher at 132.55 million. In total, about 21% households have two-wheelers, whereas only 4.7% of households in India have either cars or jeeps or vans. Despite this, the number of deaths caused by traffic is amongst the highest in the world and is still increasing. The automobile industry in India is currently rapidly growing with an annual production of over 4.6 million vehicles, with an annual growth rate of 10.5%, and vehicle volume is expected to rise greatly in the future. Bullock carts have been traditionally used for transport, especially in rural India. The horse carriages were used for transport since early days. Today, they are used in smaller towns and are referred as tonga or buggies. India's roads are crowded with cars, trucks, motorbikes, auto rickshaws, bullock carts and tongas. Each group of drivers comes with their own set of unique problems that are affected by the nature of the vehicle, nature of the work, and length of working hours. Quite often, this influences lifestyle changes that lead to susceptibility to a unique set of health problems. Distribution of workforce. Drivers in India may be engaged in transport or ferrying passengers. They may be governed under the Motor Vehicles Act if they are using mechanized vehicles. Horse-drawn carriages have been deemed illegal in one state, though they are popular. Drivers largely fall into the following categories. 1. Transport workers. These are again divided into those who transport goods over long distances, such as the truck drivers, and those who transport goods over smaller distances, such as within the city. The second category usually consists of tempos or medium-sized commercial vehicles. 2. Ferrying people. Those who ferry people over short or long distances fall in this category. This includes the rickshaw drivers who drive cycle rickshaws or automated rickshaw, the bullock cart-driven vehicles, the cab drivers who may ferry people within the city or between cities, and the bus drivers who either operate public or private transport vehicles. Characteristics of work. They are also exposed to several risks and hazards such as vibrations, noise, injury, violence, heat, cold, dangerous substances, and fatigue. The following problem areas characterize the working patterns of drivers. 1. Professional drivers have a lifestyle that is not conducive to good health. In addition to their exposure to noise and air pollution, the job does not provide the same opportunities for social contact as many other jobs, and shift work, unsocial hours, etc. can disrupt both home life and social activity. Home life and social contacts provide a powerful source of support for those experiencing stress, and an absence of this support compounds an already difficult problem. These men are away from their families for long durations, and in the unhealthy environment along the highways, they become easy prey for commercial sex workers, making them vulnerable to sexually transmitted diseases or STDs and HIV or AIDS. 2. Drivers are more likely to have a diet that is not conducive to health than those groups of workers who can return home for an evening meal on a regular basis and take regular meal breaks in a staff canteen. A diet high in fats and carbohydrates and low in fresh fruit, salads, and fiber will add to the level of poor health. 3. The incidence of smoking and drinking can also create health problems. 4. Drivers are exposed to a number of health problems as a direct result of the posture adopted in driving. Sitting in the driving position exerts considerable forces on the spine and can cause a number of problems with the musculoskeletal system, in particular backaches, neck problems, pulled muscles, and general stiffness. The driving posture also causes problems for the digestive system. 5. Truck drivers are continuously exposed to various types of pollutants, especially air pollutants emitted from vehicles and blowing of horn. 6. Truck drivers have a higher degree of continuous exposure to low-grade whole-body vibration, or WBV. 7. For auto rickshaw drivers, the problems encountered were limited. And 8. Painful mobility of wrists, back pain, and poor vision due to cataract. And 9. Not wearing proper glasses. 10. India has a high rate of 18.9 accidents per 1 lakh people. Drivers who are usually single breadwinners for their families usually become victims to accidents and fatalities. 11. Exposure to fossil fuels and noxious chemicals makes the drivers prone to a large number of respiratory affections. 12. Drivers may be prone to systemic problems due to their largely stress-related lifestyles. Health problems and disease patterns. Health hazards of these drivers are described below with their causative sources and manifestations. While accidents and mechanical injuries are the main afflictions that affect people in this occupation, a large effort by many organizations in recent years has also focused on sexually transmitted diseases or STDs and HIV transmission among drivers. Health condition and causative source. Injuries and physical harm conditions. Road accidents. The major accident types are 1. Vehicle crashes. 2. People being struck or run over by moving vehicles during reversing or coupling. 3. People falling from vehicles. 4. People struck by objects falling from vehicles or vehicles overturning. Causative source. Each vehicle has its own problems that may contribute to accidents. 1. The reduced braking and evasive abilities of trucks can contribute to situations more often developing into collisions, and the collisions occur at higher speed. The size and weight of trucks may mean that collisions result in more serious personal injuries than similar collisions involving passenger cars. Passenger cars may run at high speeds, leading to high friction on freeways and expressways, causing tires to burst. Animal-driven vehicles are usually slow and more difficult to maneuver. Driving at unnaturally high speeds may cause the vehicle to turn over. Additionally, the following conditions may also predispose to accidents: overloaded, unbalanced load, and inadequate cargo securing. High speed in spite of bad weather. Unsafe driving due to time pressure without adequate periods of planned rest for drivers. Driving under the influence of alcohol and driving while undertaking distracting or demanding tasks. Loss of control due to brake failure. Handling dangerous and inflammable substances. Accidents during coupling and improper loading and unloading of vehicles. Causative source. The driver did not have any instructions on the loading and unloading process and handling of the material in question. The customer had not carried out a risk analysis of the unloading bay, failing to ensure that the loading procedure is supervised by a skilled employee. Using appropriate cargo straps. Using forklifts for other purposes than intended. Fractures. Usually, fractures of the ribs and shoulder may occur during maintenance work. Causative source. Improperly maintaining vehicles and using lifting jacks. Failure to implement standard safety procedures to maintain the trucks. No training and information for workers concerning the safe use of lifting jack. Burns. Causative source. Handling inflammable substances or hot substances such as bitumen. Explosion of battery or fuel tanks. Musculoskeletal conditions. Pain. Low back pain. Causative source. Low-grade whole-body vibration and constantly sitting in one position may be the main causes. Wrist and hand sprains. Affecting ligaments. Causative source. Usually seen in drivers of auto rickshaws who have to use the wrist to change gears or raise the acceleration of the vehicles. Respiratory conditions. Occupational asthma. Breathlessness with chronic cough and coryza. Causative source. It has been observed to be higher in tempo drivers due to higher exposure to dust and vehicular pollution in urban areas. Circulatory conditions. Hypertension. Causative source. This is observed commonly in truck drivers. Chronic stress seems to be the main cause. Eating at roadside eateries that serve food that is oily and salty. Anemia. Causative source. A poor diet that is low in nutrients. Dermatological conditions. Pilonidal sinus. This usually occurs around the perianal region. Causative source. Sitting position for a long time and excessive perspiration in the area may lead to strands of hair to get stuck in injuries leading to the condition. Ear, nose and throat conditions. Noise-induced hearing loss or NIHL. Causative source. Peculiarly in Indian conditions, driving is a very noisy affair with a lot of honking and noise emitted from accelerators of poorly maintained vehicles. Noise pollution levels on Indian roads are significantly higher than in other countries. Ophthalmological conditions. Refractive errors and early cataract. Causative source. Driving a vehicle is a demanding and strenuous task that requires good visual acuity and sharp reflexes. The visual strain is often increased due to environmental lighting and glare from headlights of other vehicles. Gastrointestinal conditions. Acid peptic disease and dyspepsia. Causative source. Tobacco use and irregular eating habits. Infectious conditions. Sexually transmitted diseases and HIV or AIDS. Causative source. Truck drivers are more prone as they travel long distances and are usually away from home and have statistically reported higher rates of intercourse with multiple partners. Ideal recommendations for health, safety and welfare of vehicle drivers. Please advise your patients who are vehicle drivers the following conditions under which they should not drive. Fatigue, alcohol, drugs either prescription or illicit, temporary illness like influenza, a medical condition like uncontrolled diabetes, any recent stressful event, and also they should have eyes tested regularly. Have them examined at least every 2 years or as advised by a doctor. Preventive interventions require strategic contribution and efforts from government through occupational health and safety policy and legislation, cooperation from employers as well as workers, and advice from medical professionals. Occupational diseases manifest after long latency period from the time of exposure. There are challenges to establish and declare that a disease is due to hazard at workplace. Elaborate guidelines for management and prevention of occupationally caused diseases is beyond the scope of this documentary, as currently there is no mechanism for doctors to enforce their recommendation without a statutory backing. We therefore give general principles of prevention. Preventive measures should be designed and implemented at 3 levels of prevention. 1. Primary prevention aims to reduce the occurrence of disease by eliminating the cause of disease, for example, use of benzene-free solvents or solvent-free paints to eliminate the risk of carcinogenicity, or reducing exposure to safe levels that prevent it from causing damage, for example, reducing noise at its source to levels that do not cause noise-induced deafness. 2. Secondary prevention to identify and treat health problems as early as possible, often before symptoms have developed, in order to take corrective action. For example, regular audiograms among workers exposed to high levels of noise in the work environment. 3. Tertiary prevention aims to avoid complications of and disability from illnesses and injuries and/or to provide rehabilitative and palliative care. It aims to minimize the consequences in persons who already have disease and depends on appropriate treatment. We expect that the primary care physicians are already well versed with clinical knowledge for management of the occupationally caused health conditions. To learn more about detailed clinical perspective, treatment and prevention and control, please refer to ebook or printed version of BOHS for informal industry, manual for primary care providers. So, if your next patient with any of the presenting symptoms we described earlier comes for treatment, please don't forget to ask him the million-dollar question. What exactly is the nature of your work?